This is Dr. Toby Moma, your host on health and wellness, inviting you to watch our show this week, hosting Dr. Raman Singh. Dr. Raman Singh is the president medical staff for Vital Core Medical Strategies. Dr. Raman Singh used to be the medical director for the Louisiana Department of Corrections. He went to medical school in India, trained at one of the best schools. He went to Nehru Medical School in near Delhi in India. Then he came to the United States and went to Bronx Lebanon Hospital for his residency in internal medicine. Dr. Raman Singh is happily married with 2 children. His wife is a family physician, and he's going to be sharing his heart for correctional medicine. As the president of the medical staff for Vital Core, he oversees several prisons, more than 75 all across the nation. And he's going to be giving us the insight that he has used to pilot this program all across the United States. You don't want to miss it. Jesus is Lord. Amen. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. Don't touch that dial. We have a great show with Dr. Raman Singh. Dr. Raman Singh is a veteran of 20 years experience in the correctional medicine industry. He's an asset. He's as a bulwark. He has walked the walk. He has talked the talk, and he's going to be sharing his experience with us. Board certified in internal medicine, being a medical director for the state of Louisiana Corrections, now also this medical director for the state of Mississippi, working as a president of medical staff for Vericom. He's going to be talking about what he sees as the future of correctional medicine. You don't want to miss it. Thank you so much for joining us, Dr. Raman Singh. So, in a nutshell, what is the prisoner experience in terms of clinical care? What should a prisoner expect when they come to the prison? Can they compare what they get to what they get outside the prison? That's what some of my viewers are asking under the circumstances that they meet. Obviously, they're prisoners, but what experience should they expect when they walk into the clinic in the prison?
That's a great question, and I think unfortunately the answer is uh, the prisons are struggling to provide appropriate health care to inmates, and it's a multifactorial, a lack of resources, as well as this group has a very high medical needs because they never had meaningful access to health care, and a disproportionately high number of risk factors for chronic conditions. As a standard, every prison does an intake screening, which is a thorough screening of all medical conditions to ensure continuity of care, to identify any red flags that someone is detoxing or if someone is suicidal. A high percentage of prisoners have significant mental health issues, which are either completely untreated or their needs are partially met. And prisons are the perfect bed for a flare up of all these mental health conditions. But a prisoner should expect appropriate health care because that is the prison's responsibility.
When a prisoner leaves prison, what should his or her family expect? Should they get 2 weeks of medicines? Should they get a referral to a community physician? Should they get a letter of like their medical records? I mean, what? Because I've heard of prisoners who left and within a couple of weeks they were back in the prison. And some claim it's because the medical facilities were not doing due diligence to that prisoner. For example, they claim a patient who has bipolar schizophrenia was discharged without sufficient meds, sufficient follow-up, sufficient psychiatry instruction, and therefore they relapsed, decompensated, and returned to the prison. So is that something that you've seen over the years, or is that not true?
No, yes, the answer is I have seen it. Um, I would like to, if that's okay with you, to change a question.
Okay.
And the question I think the viewer should be asking, what should Louisiana expect from this discharge process? And here is the answer. When Governor Edwards expanded Medicaid, and I know it's politically controversial, but I'm not a politician. I'm just a public servant, a humble one. And we made these plans because we could put prisoners on Medicaid. And Dr. Rebecca Gee, who was Secretary of Health, and she did a PowerPoint. The goal of a correction is to make Louisiana safer. That is the truth. You convict criminals, you rehabilitate, and then you discharge them back to the society. But by joining forces, healthcare is a very important piece to produce or sustain a healthy workforce and to keep your state healthier. By joining forces, what we could have done and what we have done is not only a safer Louisiana, but a healthier Louisiana, because you have at high risk individuals under one roof. And if you do good diagnostic system, and then you engage them in the safety net, and then you ensure continuity of care upon discharge by establishing these networks and communication with the providers in community, by working with probation and parole, and by working with Office of Behavioral Health, then all this good work done inside the prison, funded by the taxpayers, millions of dollars, is not lost. Unfortunately, the system was not set up to do that. You know, it's a very fragmented system.
Right.
Everyone works in silo. No one was sharing information, and no one could even see that just by sharing information. So if someone is being arrested, like in Caddo Parish, or like right here, Tallulah, this guy, if he's a schizophrenic, he's on a medication, that prison nurse has no idea to verify about Zyprexa, Zoloft. The provider is not going to order those medications. There is no way, because there are so much HIPAA, there are so much confidentiality issues. So in my 10 years, actually, I was, that was my passion, actually, re-entry and especially mental health.
Okay.
If you can break down these silos, and through Medicaid expansion, there is a Louisiana Health Information Exchange. You communicate all this information. You get them in Medicaid. So once Louisiana was the first state to find the loophole how to put patients and inmates on Medicaid. We had saved at least $65 million in 6 years by using this Medicaid for inmates.
Wow.
So once the Governor Edwards expanded Medicaid, that opened the door. So what we had done is enrolling every inmate on Medicaid and suspend the status and flip the switch once they are being released.
Wow.
So they were on Medicaid, because Medicaid is the most cost-effective, the low-cost option to provide access to care to a very needy population who have either serious diabetes, HIV, hepatitis C, or any serious mental health condition. So what's happening, these mental health conditions, if they don't get treated, then these patients, and it's a very small group of people, they start to act out. They go and hurt people in the community.
Right.
They are victims. You know, they become homeless. They keep on recycling through the criminal justice system, where taxpayers are paying for their housing and their care at a much higher cost, because
Wow.
to send a psychiatrist to Angola has an added cost. So if you remove yourself, that you are a correctional person, if you think what is best for the state, what is best for Louisiana taxpayers, what is the most cost-effective way, the way is have effective communication, work as a team. Department of Health, Department of Corrections, and LSU, they all have to partner, Office of Behavioral Health, and get these people, engage them in the safety net, have enough steps in the place to make sure they stay engaged through the care coordination, so that they can be treated in the outpatient clinics rather than in emergency rooms at a very low cost, and they
Right.
can stay healthy, so they can be turned into the tax-producing citizens rather than being a drain on the taxpayers.
So you cannot file for Medicaid while they're in prison.
Now you can.
Oh, now you can.
Now you can, but
Okay.
you cannot access Medicaid benefits. So the Louisiana, actually, you all will be proud of this fact. The first state in the country which created the system. Now it's, you know, with hindsight, it's easy for me to say these things have been done, but bless our heart, the Medicaid department, it was a lot of figuring out
Of
how to
course.
do it
Yeah.
in their computer system. They're like multiple different systems. So we filled out the enrollment paper for all inmates in our
Prisoners.
custody, and then they were enrolled and they were suspended. Upon release, we created an IT interface which used to send this release data to Medicaid, and Medicaid used to flip switch back. So from day one, those inmates were on Medicaid,
Have insurance.
have insurance, and Medicaid is a very low-cost
Of
insurance,
course, of course.
and it was saving taxpayers so much money.
Wow.
Yep.
But you cannot do it for Medicare too, because Medicare is federal.
Yes.
So there's more paperwork. Because for the inmates who are above 65, you know, you'll think they may benefit from Medicare.
So both of them
As
are
well.
federal programs. However, just in a nutshell, Medicaid is for poor and disabled,
Right.
and Medicare is 65, and you have to have contributed to our Social
So
Security.
if you didn't contribute, that
Didn't
might be-
contribute, then you don't get to be on Medicare.
Wow, wow. That's quite novel. Really proud of what you guys did. Now, did you get any training in correctional medicine? Because what my viewers are asking, you know, if I'm going to be a physician in a prison, do I need additional training to my medical school residency? Is there specialized training for this field of medicine?
Well, now there is. Actually, Dr. Newton Kendick, and I work closely with him. He's a professor at George Washington University. He had just started a correctional healthcare fellowship, as well as Dr. Dave Thomas in Florida. He had just started correctional healthcare fellowship. However, in my experience, if you think about working in correctional, just do your training really well. Because this is a definitive care, like good old country doctor. You know, inmates have right to access to health care, but they don't have a right to dictate the treatment. So the physicians and the nurses and nurse practitioners who work in corrections, it's really a good service to taxpayers if we know the science really well, so that we don't give into these games being played and we don't abuse taxpayers' trust in us.
What do you see as the future of correctional medicine in the light of COVID, in the light of privatization? What do you see? Because people have said it's become a business, it's become a money-making scheme. So tell us, correctional medicine in 20 years' time, what do you see as the future of it? Are we going to have EHRs in all our correctional facilities? Are we going to have robotic surgery? Are we? What do you think? Are we gonna? Very few prisons have hospitals, by the way. So that's not gonna happen. The robotic surgery part. So.
Yeah. Well, so this is actually a good question, which has a two-piece. So prison healthcare is basically coming out from the prison and from the incarceration status of a state. Lately, I have seen this good trend, and especially in Louisiana, they have done a good job in reversing the trend and realizing that pendulum has swung too far in one direction, and they have really good reentry initiatives to reduce the prison population. After that, so corrections do not dictate the corrections population. This is mostly about the judiciary and district attorneys and the sentencing laws. They dictate the number of offenders. Healthcare is mandatory. Once you incarcerate, then you have to provide healthcare. And healthcare science has advanced so much, and you have to keep up. Constitutionally, a state cannot deny if there's a new treatment for hepatitis C. Though, you know, people wish that you don't have to spend money, but that's people who have been around for a long time, they know that's not a choice. And that's like being an ostrich with head stuck in the sand and with a very hefty price tag in view of the lawsuits and everything. So if hepatitis C treatment has a new drug which came out in 2015, $60,000 per treatment, guess what? That's what the prisons had to find the money to do it. So in Louisiana, we accessed 340B program. Dr. Cassidy, Dr. Rebecca Gee did a great job in negotiating the price down. So the prison healthcare is joined at hip by the healthcare advancements in the community. And the prison population is tied to more criminal justice policies.
Right. Have you heard of prisoners being wary of the medical facilities because they think they are used as guinea pigs? Have you heard of that? I've heard of that in the past in research with the African American population because of the Tuskegee, syphilis trial and all that. But has anybody in the prison system mentioned skepticism among prisoners, maybe in Louisiana and Mississippi, about the medical care? Do you ever hear people say that I'm being used as a guinea pig, I'm being experimented on? are you taking my blood for some tests? I know you guys don't routinely do drug trials on the prisoners. Am I correct?
Well, yes, and I have seen this concern, and I totally understand why people are concerned because history really runs deep, and it goes back to the trust issue. Unfortunately, many prison systems had physicians with suspended licenses with some black histories, and they may not have been competent, and that creates an environment of mistrust, and actually it leads to an abuse, and where the state ends up spending more money because prisoners, when they don't trust, then they try to overuse the system, just making sure kind of thing. And of course, there are bad examples like Tuskegee experiment, but since then I think the country has learned there are very tough federal regulations where no one can do any trial on any prisoners, period. That's it.
Do you routinely do any drug trials
No.
on the prisoners?
No, no.
Right.
It's not allowed by either American Correctional Association or
Right.
by National Commission on Correctional Health Care.
Tell us a bit. I want to use this word. What's the greatest experience? The question I wrote here was, which one experience stands you out in all your years of prison medicine? Which experience stands you out? And I know you've had several. As a correctional physician, okay, was there any momentous occasion? Maybe you brought somebody back to life. You diagnosed the condition. Was there something that you'd never forgotten that stays with you after 20 years?
Yes, well, there are many.
You can say quite a few.
And being a physician, you have definitely saved lives.
Right.
You help people. And of course, I find this profession to be very satisfying. And I'm a blessed man. But the one experience which really stands out had nothing to do with me being a physician. So I was medical mental health director, and I was realizing this high number of inmates with a substance use disorder diagnosis, being on drugs. And they never got treated, and treatments are not as effective because it's a long-term treatment. Relapse is a part of the recovery kind of thing. And then I realized that we don't have any good program for women. And I used to go to different churches, and churches focus so much faith-based organizations on the foundation of family and intact family.
Right.
And coming from India, in India, women have a special status, because they are the rock on which this family stands. Men are supposed to work, and the women are taking care of the family. And suddenly an idea came to me that we don't really do much about the women. They are like, such a small percentage. They were completely forgotten. So I reached out to Dr. Susan Tucker. She's from here. She's a phenomenal psychologist. And we opened a drug treatment program for women. Then I was telling you about reentry. We used to work with probation and parole. And I started to make the rounds going and seeing. Because everyone, who works for me, yeah, the program is great. No one says that people are doing a bad job. No one self-criticizes. So with the probation and parole officer, I go to this not nice neighborhood in Baton Rouge in a trailer, and he pulls out this parolee. And I think she was 26 years old at that time. And she knew my name. She was given a flyer. So I was asking, so how are you doing 3 months after the discharge? So here is the story she told me. She said she was 7 years old when she was raped by her stepfather. And when she told this to her mom became jealous of her and became very angry. So her heart was broken because her mom didn't support her. Right. Within the next few years, she said every family member was raping her. By the time she was 11 years old, she started to do the drugs to ease her pain. And then within the next few years, she became totally dependent on the drugs. Wow. And then she started to prostitute to support her drug habits. She had done this, multiple arrests, multiple incarcerations, recycling through the criminal justice system. But this program by Dr. Tucker was phenomenal and had really helped her. But when we discharged, guess where she could go back to? Same house where people had taken her body for granted. So all that pain, and that made me realize that we have this habit of looking from one angle and fixing the problem and patting our back. If we really want to bend the curve, we have to find a comprehensive solution to empower families and support the families,
Right.
provide proper treatment in the context
Right.
so that they can be helped. Otherwise, it's like bobblehead.
Yeah.
So her tears, actually, they still echo with me that maybe as a society, we can do more
Mm-hmm.
to help people.
Wow. You just recently stopped working for the Louisiana State Corrections. What's the, I know it's a painful outcome, but you want to share what you learned from your 15, 17 years with the Louisiana Corrections? Because, you know, people have lessons they learn at the end of their journey. I want you to just share what lessons you learned in spite of maybe the difficult times. I'm sure there were lessons you learned.
Absolutely.
Was
The
it 15 years or
17 years.
17 years.
Then I was accused, falsely accused, of hugging my coworker and telling her that I loved her in front of her husband while we were at a conference, and that place had all the video cameras. I went back to my wife straight and I told her, and I had not done it. The choice was hard. I was told to resign, but we had decided to fight for the truth.
Right.
And this is Harvey Weinstein time. It was very easy to throw an allegation, and in the court of public opinion, everyone was guilty. It was very hard for me to fight. I was fired from my job. I really had tough time, really. But we kept on fighting because, you know, I'm an immigrant.
Right.
And the name, that's all I have,
That's
which I pass on to my kids, and my kids are very important to me.
That's right.
Eventually, after 2.5 years where taxpayers spent almost $500,000 in defending the accusations, can you believe? Taxpayers, they don't even know. They have spent $500,000 in defending the allegations, and they fell apart like a house of cards.
Wow.
Because that was not true. Now, when my trial was about to start, the defendant, the person who accused me, as well as the Secretary of Corrections, have signed a legal document voluntarily that I had never done all those things.
Wow.
I had never done all those things. So going through the dark time, Dr. Moma, I'm going to tell you, here is a lesson learned. Are you ready?
Yes, sir.
What matters in life is not prestige, not job title,
Wow.
not the car I drive, not the suit I wear. What really matters in life, family, friends, and faith.
Wow.
That's what really matters in
Because
life.
I know a lot of your friends probably they stayed away
Oh.
because everybody thought you were like blacklisted. I mean,
Yep. No one would touch me with a 10-foot pole. But now, you know, I'm in a much better place. I think when I look back, my wife and I have this firm belief that was the best thing ever happened to me. Best thing. That opened the door for me to find myself, literally. You know, I really cried. I used to sit in my house. I was suspended for 9 months. I had no job.
Wow.
All day I used to cry. All day I used to cry. Then I used to think about Nelson Mandela a lot. Seriously.
27 years. In
Have you heard that poem, Invictus? He wrote that poem down on the wall of the cell.
Wow.
Nelson Mandela went to the prison as a very, very angry black man. Very, very angry black man. And he came out as a statesman,
Wow.
as a person who had changed the world. So these crises, you know, a lot of people told me that this adversity had built my character. And you know what I really think? Like what I had seen in Katrina and what I have seen now, adversity only reveals who you are, literally. One day you may want to read that poem, Invictus.
I will.
That carried
I
me
will.
through.
Wow.
Yep.
Wow. That brings tears to your eyes and to our eyes. Thank you so much for your service. And now, when did you, I mean, was it in the middle of all this that you got involved with Vital Core? Or was this after the whole lawsuit had ended? Because at times God opens other doors when one shuts. You know, you never know your opportunities until.
So when this happened, no one in Louisiana would give me a job. I had job offers from other states, but Louisiana is home. And you know what we figured out? When you are under attack, you just don't leave your home. because someone is falsely accusing, attacking you.
Right.
That's what they wanted me to do, to run away like an immigrant.
Wow.
Yeah, I'm an immigrant, but my home is Louisiana.
Right.
Seriously, I'm not going to leave my home. So I stayed home, and then I found, well, I opened my practice, and it was working well. But then Vital Code approached me. My lawsuit is still going on, but they knew the truth.
Okay.
The corrections world knew the truth. Seriously, they knew the truth. Here you go.
Wow.
So they had no problem, and then I won. I really didn't win. To me, when the accuser comes and signs a legal affidavit in front of a judge saying that I had never done it,
wow, that is
so the truth
shocking.
always prevails.
And Vital Core, you work over 10 states
Yes.
or so, but your base is still Baton Rouge or
That's my
Mississippi.
home. Yeah, that's
Okay.
my home. So Vital Core is growing in leaps and bounds, really. So we have 3 state correctional systems: Mississippi, Vermont, Virginia. We are about to pick 2 more. We are in 64 big jails: Galveston,
Wow.
most of the jails in Michigan, New Mexico, Arizona, California. And I just happen to be the president of the entire company as well as the chief medical officer.
Wow. And of course, you do a lot of work with Warden Kane because you supervise the Mississippi State
Yep.
the health part of the Department of Corrections.
Yeah. I call it Mississippi magic.
Oh,
What we
really?
did in Louisiana, we are doing in Mississippi.
All right. Any advice for any of your colleagues who might want to go into correctional medicine? Any of your advice to viewers about correctional medicine?
If you want to serve, and we all are different, and I'm sure going through medical school is a tough process, a big student loan, payoff, and the dreams. But if your heart is about serving and helping, there's a good money, means you get decent pay, you get decent benefits, no hassle with insurance companies, and you take care of the most vulnerable population. You take care of their health, as well as you contribute to what's called social determinants of health to improve overall health care. This is a small group of people who are holding the entire society back and the progress, making Louisiana as the worst state when it comes to healthcare indicators. A very small group of people. So your intervention is going to be so effective in moving the entire state forward by if you care. So it's a challenging. I'm not going to tell you it's a bed of roses. Of course, it's a very tough population to deal with. But deep down in their heart, they really know that if you mean to help them and you get so much respect from correctional officers, I can go on and on and on. That's my family. Louisiana
Wow.
correctional officers and the nurses, they are my family. Literally, they're my family. They work hard, most unappreciated people. No one knows about what they do, but that's a wonderful place to work.
We'll be back. Last show coming up next week. He's going to tell us about what he did in Mississippi with COVID-19 and the correctional system. Look forward to seeing you next week. Jesus is Lord. Amen.